Hello all and welcome back. In today's episode, we're going to be exploring a supplement protocol for colds, flus, and COVID. I would just like to state that before making any changes to your diet or supplement routine, to please consult a healthcare professional and or your doctor. If you are taking any medication or are on any medication, please do not make any changes to taking your medication whatsoever. The information on this video is simply for educational purposes and is not and should not be substituted as medical advice. Now, throughout this episode, I will be referring to my notes a lot as I am reading several randomized controlled trials, and I want to make sure that I'm getting the mechanisms correct and the trials correct and not confusing them, having read them many times over. I hope this isn't too complicated, and I hope I've broken it down enough. If you have any questions or queries, please do leave them in the comments and I will try my best to answer them. So many people are coming to me saying that they've caught some kind of a flu or COVID, and it is that time of year where virulence for these airborne viruses are very high. So my aim of this video is to try and provide you with some supplemental tools that may help prophylactically or help shorten the duration of a cold, flu or COVID or lessen the symptoms. So the first supplement I'm going to be touching upon is by far the most key one out of the lot, and that is vitamin D. Now, I have touched upon vitamin D previously. Now, vitamin D is not just a vitamin or a supplement. It is a steroid hormone that regulates at least 5% of the human encoded genome. Now, it's known to enhance innate immunity, it has antiviral properties, helps disrupt viral envelopes, and it also helps with the secretion of immune peptides. So there was a meta-analysis conducted of various randomized controlled trials that showed that vitamin D had a prophylactic effect against influenza. So it means it helped stop incidences, reduce instances of influenza or flu. Overall, it suggested that strategies for preventing influenza can be optimized by vitamin D supplementation. Vitamin D is prophylactic. Various studies also show that those with low levels of vitamin D were more likely to end up hospitalized with COVID-19 than those who had sufficient levels. Now, I have to say, I would be really interested to know what a trial would show if vitamin D was combined with K2 and magnesium. Now, as we spoke in the first vitamin D episode, K2 helps with the absorption of vitamin D and sends calcium to the right places, and the magnesium helps activate the vitamin D. So I would be really curious to see what a trial results would show if they actually helped vitamin D function to the best of its ability. So moving on to dosage, I would say prophylactically between 1,000 international units and 4,000 international units. Now, 4,000 international units has been set as the upper limit. You should always have a blood test done, check where your levels are, and discuss with your doctor. But those doses are a great way to start prophylactically taking vitamin D. So timing wise, again, I would say all year round really. Again, have your levels checked and measured. Maybe you do need less in the summer if you're getting lots and lots of sunlight. There are obviously precautions that should be taken there as well, but definitely in the winter months when there's much less sunlight, definitely be taking prophylactic vitamin D. Now, just to mention, you should definitely take vitamin D and or indeed all supplements with a fatty meal. Vitamin D is a fat soluble supplement and should definitely be taken with fat. And remember, for better absorption, combine it with magnesium and vitamin K2. So to summarize vitamin D is a steroid hormone involved in regulating immune function and gene expression. It enhances the body's innate immune response and may help defend against respiratory viruses. Studies suggest that it can reduce the risk of cold, flus, and COVID, especially in those who are deficient. Okay, so moving on to zinc. So zinc is an essential trace mineral that your body requires to carry out the majority of its functions. So when it comes to zinc's immune properties against viral pathogens, zinc is essential for the activity of T cells, natural killer cells, and neutrophils, and these are the most phagocytic cells, meaning they help engulf pathogens, which are all vital to the immune response and for responding to viral infections. Zinc also inhibits viral RNA-dependent RNA polymerases. So when intracellular concentrations of zinc is high, zinc can directly interfere with the viral replicase system of RNA viruses. So this reduces the viral RNA synthesis and prevents replication. So viruses don't really want to kill people, they want to spread and mutate. Why? It's not certain. So the key aim of viruses is to get into your cells and then basically become a photocopying machine and copy and copy and copy and copy and copy and copy and keep spreading. So when we discuss supplements and protocols and even pharmaceutical interventions, it's to try and prevent and stop and interfere that replication process, as that way you stop the virus pretty much dead in its tracks. Now, there is a issue and problem with zinc, and a pretty big one. So zinc is not easily transported into cells intracellularly at large amounts in order to inhibit viral replication. So it does need help getting inside the cell and becoming high in concentration intracellularly. So zinc hasn't inherently shown to reduce incidences of cold and flus in trials, but has shown to shorten the duration and severity of them. Now, the reason why I don't think zinc showed a prevention in incidences of colds and flus was because it wasn't combined with an ionophore. So a zinc ionophore is a substance that helps zinc ions cross the cell membrane and enter cells so that they can perform their vital functions, such as boosting the immune system and inhibiting the viral replication. So the reason why I don't think zinc showed prevention in incidences of colds, flus and COVID was because it wasn't paired with an ionophore in these trials. So because zinc has an issue and problem getting into the cell on its own, it does require an ionophore to help carry the charged zinc particles into the cells. This then increases intracellular zinc and thereby enhances the zinc-dependent biological processes. So when it comes to zinc dosing, I personally take 30 milligrams of zinc perchylinate a day, and I do pair this with an ionophore called quercetin, which we're going to move on to in a moment. So between 15 and 30 milligrams of zinc, you can take citrate, you can take perchylinate. I wouldn't take elemental just because it's not as well as absorbed as the other two, but I would definitely suggest either citrate or perchylinate, and I would take that daily just for immune maintenance. For acute use, up to 75 milligrams, particularly of zinc lozenges, it was mentioned in the literature, can be useful with an onset of a cold or flu to help with the onset. So you can take it timing wise just for maintenance, but you can also take it with the onset of a cold or flu. I would also just like to add that maintenance wise, 40 milligrams per day is the upper safety recommended amount. Anything more than that and you may become deficient in copper, as zinc and copper compete for absorption in the body. So to summarize zinc is essential for immune function and plays a direct antiviral role by interfering with viral replication inside cells. It supports key immune cells like T cells and natural killer cells. While zinc may not prevent colds and flus, studies suggest that it can reduce their duration and severity, especially when paired with a zinc ionophore to enhance cellular uptake. Moving on to quercetin. Now, I've briefly just touched upon quercetin. So quercetin is a polyphenolic flavonoid that exhibits broad spectrum antiviral activity through multiple mechanisms. It acts as an antiviral, antioxidant, anti-inflammatory, and an ionophore. So, as I previously said, quercetin facilitates the intracellular zinc uptake in cells. This then allows zinc to combat viral replication. So what happens is that quercetin binds zinc and forms a complex that can cross the lipid bilayer of the cell membrane. This then effectively increases the intracellular levels of zinc. So quercetin also has very powerful and potent anti-inflammatory. So quercetin can reduce cytokine production, for example, interleukin number 6 or tumor necrosis factor alpha, and inhibits also NF-kappa B. So it's very, very beneficial in respiratory infections, particularly even COVID-19 related cytokine dysregulation. It does also have some antiviral effects on its own. So quercetin has been shown to directly inhibit viral enzymes and interfere with virus entry and replication, particularly in influenza. Particularly in influenza, rhinoviruses, which is the common cold, and coronaviruses. So zinc plus quercetin equals enhanced intracellular zinc, which leads to the inhibition of viral replication. Okay, that's the mechanism. So think of quercetin that unlocks the door to let zinc into the cell, where zinc that can then actually interfere with the virus. So with respect to quercetin dosaging, long-term studies haven't really been done. There aren't many reports, if any, of toxicity from quercetin or negative symptomology from taking quercetin. Generally, the recommended dosage is 500 milligrams, which I take prophylactically every single day. I also do in the evening take a further, I think it's 150 milligrams of liposomal quercetin, so it enhances the absorption of the quercetin in the evening. But I would say that 500 milligrams is a great prophylactic starting point, and you can probably move up to a gram, so 1,000 milligrams of quercetin during a cold, flu, or when you feel an early onset of a cold, flu, or virus. Make sure you take quercetin with fat, as it is fat soluble, and also make sure to take zinc with it to get the full benefit. So in summary, quercetin is a plant-derived flavonoid with antiviral, anti-inflammatory, and antioxidant properties. It also acts as a zinc ionophore, helping transport zinc into cells where it can inhibit viral replication. Research shows that quercetin can help modulate the immune response and reduce inflammation. It can also directly interfere with the life cycle of certain viruses, including influenza and coronaviruses. So vitamin D, zinc, and quercetin are the foundational immune support supplements that I would recommend. We are now going to start touching upon some other supplements that are really good for preserving gut barrier integrity, which has a lot to do with immune support and function if you watch my previous microbiome video. So the first one that we're going to touch upon is L-Glutamine. So L-Glutamine is an amino acid. It's actually the most abundant amino acid in the body, and it's involved in many bodily functions such as immune support, energy production, and tissue repair. So it's a major fuel source for immune cells, especially during inflammation, injury, or infection. This is when it becomes a conditionally essential amino acid. So in particular, lymphocytes, neutrophils, and macrophages actually consume L-glutamine in quite large amounts and at high rates, similar to or even greater than they do glucose. This is in order to generate energy and support their functions. So glutamine is essential for proliferation and activation of immune cells, allowing them to rapidly multiply and respond to infections. So it really does provide macrophages and neutrophils, which are the most phagocytic immune cells, meaning they engulf pathogens the best, which is so important for the immune response. When discussing doses of L-glutamine, between 5 and 10 grams daily, and it can be divided into different doses as you like throughout the day. That generally seems to be where the literature suggests. And in terms of timing, just daily supplementation, as in it doesn't really matter. It's generally safe for most people and can be taken with or without food. So in summary, L-glutamine is the most abundant amino acid in the body, and it plays a key role in immune function and gut barrier integrity. It serves as a primary fuel source for immune cells like lymphocytes, macrophages, and neutrophils, especially during infection, inflammation, or any kind of injury. And it does this by supporting immune cell activity, maintaining the gut lining, and glutamine overall just helps strengthen the forefront line defenses against viral infections. So next up is vitamin A. Vitamin A is crucial for gut barrier integrity and tight junctions. So vitamin A helps maintain the expression of tight junction proteins in the intestinal epithelium, thus reducing gut permeability or leaky gut. It's also very important for the regulation of immune cells. So vitamin A is involved in immune cell activation, cytokine modulation, and epithelial homeostasis. So vitamin A is essential for maintaining mucosal and epithelial health. It helps regulate cytokine production and supports innate and adaptive immunity. Vitamin A deficiency does lead to dysregulated cytokine profiles, weakened mucosal immunity, and increased susceptibility to infection. Anecdotally speaking, since I started taking cod liver oil, which is one of the highest sources of vitamin A, I've noticed that my immune strength has greatly improved. So with respect to dosing, prophylactically speaking, I do just recommend taking a spoonful of cod liver oil daily. Now, it's really important to note that really high levels of vitamin A can cause toxicity, so please don't overdo it. Remember that vitamin A is a fat-soluble vitamin, so it needs to be taken with a fatty meal. In summary, vitamin A is essential for the integrity of mucosal barriers of the gut lining and also the respiratory tract. It supports the expression of tight junction proteins that help reduce gut permeability, and it helps regulate immune cells to maintain balanced, effective immune responses. So adequate vitamin A levels are linked to stronger mucosal defenses and better protection against respiratory infections. Moving on, we're going to be discussing colostrum. Now, colostrum is essentially the mother's first milk of generally cows. The babies only tend to use about 6 to 11% of the milk, and the rest of it is discarded. So farmers decided to put it to good use and have made colostrum powder. So colostrum is really rich in immunoglobulins, particularly IgG and also sometimes IgA. It's also a rich source of growth factors, antimicrobial peptides, and various other bioactive compounds. So these all help with mucosal immunity in particular, neutralizing pathogens and enhancing repair. So to rattle it off, colostrum helps maintain maintain and restore gut barrier integrity, it reduces gut permeability, it supports mucosal healing, it also boosts epithelial function. So colostrum does seem to modulate the immune response. It increases regulatory T cells in neonates, it improves lymphocyte function in the critically ill, and it also helps reduce infection severity. So there was a study entitled Effects on Recurrent Respiratory Tract Infections and Diarrhea in Children between 1 and 6 years old. So colostrum reportedly reduced episodes of urinary tract infections and diarrhea over follow-ups. It also improved tolerability and it resulted in fewer hospital visits. There was another study conducted entitled Colostrum in Acute Respiratory Failure, so in the critically ill and ventilated. So patients in the ICU had enteral feeding and colostrum versus control for 10 days. The colostrum group had higher CD4 and CD8 counts and lower incidences of ventilator-associated pneumonia and colostrum difficile diarrhea versus control. So generally, the dosing of colostrum is between 500 milligrams to a gram per day in capsules or powdered form. Timing-wise, during an illness or prophylactically, often for weeks and months, the timing during the day doesn't really matter. Something to note is that doses vary by product. Check for bovine colostrum with high immunoglobulin content. I have no affiliation with this company, but Armra Colostrum does a great one. In summary, colostrum provides immune supportive compounds like immunoglobulins and growth factors that help maintain gut barrier integrity, support mucosal healing, and modulate immune responses. Human studies suggest it can reduce upper respiratory infections and diarrhea in children, and improve immune markers and infection outcomes in the critically ill adults. Its role in both gut and immune function makes it a relevant consideration in broader immune support protocols. So next I'm going to move on to some antimicrobial botanicals, the first being garlic. So recent studies suggest that compounds in garlic, such as allicin, it's a tough one to say for me, may help regulate the immune response, enhancing the activity of protective cells, whilst also reducing excessive inflammation. This dual action does make it particularly relevant in viral infection like colds, flus, and COVID. So some randomized controlled trials involving garlic supplementation showed symptom severity decreasing, so less days of illness and fewer missed work or school days, but incidences of catching colds and flus wasn't significantly lowered in the trial. Another randomized controlled trial entitled Garlic for the Common Cold had 146 participants, and a garlic supplement versus placebo was given for 12 weeks. It showed fewer colds in the garlic group and fewer days of illness versus placebo. So this is some promising prevention data, but it's only one main trial and it was self-reported, so participants self-reported symptoms and quality issues were also noted. So more studies are definitely needed in order to prove this. Some studies also provide plausible antiviral and immunomodulatory action in vitro, plus limited human observational intervention data, but they are preliminary. So dosage, consistency, extract quality, and applicability to different populations still needs refinement and definitely matters. When it comes to dosing of garlic, generally the recommended dose is between 600 and 1.2 grams daily of standardized aged garlic extract. Daily supplementation, especially in cold and flu seasons, I probably wouldn't take it during the summer, I would probably just take it in the winter, and I would take this at first signs or symptoms of a cold or if you're around someone that is sick. There are some odorless forms available. Raw garlic intake also varies and can be beneficial. Make sure you take garlic supplements with food or it can hurt your stomach. So in summary, garlic, particularly aged garlic extract or allicin-rich supplements, shows evidence for reducing the severity of colds and flu-like symptoms and possibly reducing incidences in some cases. In lab studies, it inhibits SARS-CoV-2 replication and affects viral proteins and entry pathways. It also appears to dampen inflammation and oxidative stress, likely contributing to milder illnesses. But most human trials are small or limited in design, and more research is definitely needed to define optimal forms and doses. Now I'm going to move on to some antioxidant and detoxification support. I'm firstly going to start with liposomal vitamin C. So standard vitamin C is water soluble and is poorly absorbed, so you do pee most of it out. Liposomal vitamin C does increase the absorption as it's encapsulated in liposomes, which are tiny fat bubbles that resemble the body's own cell membranes. Once vitamin C is inside cells, it acts as an antioxidant, neutralizing free radicals. It also helps support immune cell function, such as neutrophils, macrophages, and T cells. It also helps regenerate other antioxidants and can modulate inflammation. These actions are relevant for respiratory infections. So a meta-analysis of randomized controlled trials found that vitamin C significantly reduced the severity of common colds by about 15%, especially for more severe symptoms. Another meta-analysis of 10 randomized controlled trials showed that vitamin C is a supplementary therapy involved in symptom relief and accelerated recovery in common cold patients compared to antiviral treatment alone. A review of vitamin C in respiratory infections, such as sepsis, COVID-19, flu, summarized that oral vitamin C, so between 2 and 8 grams daily, may reduce incidence and duration of respiratory infections. Experiments using intravenous, so IV vitamin C, between 6 and 24 grams daily has been linked to a reduction in ICU and hospital stays, mechanical ventilation time, and mortality in severe infections. So when it comes to dosing, liposomal vitamin C is definitely the way to go. Dosing between 1 and 3 grams orally for maintenance. Acute use can be up to 6 to 8 grams daily in divided doses for colds and flus, and IV vitamin C, which should only be done in hospital settings under medical supervision, can be between 6 and 24 grams daily. With respect to timing, it doesn't really matter when you take it. You can take it daily or during illness for antioxidant and immune support. I will stress liposomal forms have absolutely better absorption and bioavailability. So in summary, liposomal vitamin C absorption compared to standard vitamin D allows better cellular uptake. Inside cells, vitamin C acts as an antioxidant and supports immune cells. It also helps regulate inflammation, which are key factors in respiratory diseases and infections. Clinical studies show that vitamin C can reduce the severity and duration of the common cold, support recovery, and may improve outcomes in severe infections, including COVID-19. Moving on, I will now discuss N-acetylcysteine, or NAC for short. So NAC is the precursor to glutathione. It's one of the body's most potent antioxidants, which plays a crucial role in reducing oxidative stress and supporting immune function. So NAC exhibits mucolytic properties. Tough word for me. Mucolytic properties. This means it basically helps thin mucus, which can improve respiratory tract clearance during infections. So obviously you get quite bunged up with your nose. Taking NAC can have a similar effect to those sinus congestion sprays that you put up your nose. NAC can have a very, very similar effect. So it has anti-inflammatory effects, it modulates cytokine production, and it may possibly reduce the risk of cytokine storm in severe viral infection. NAC supports immune cell function by maintaining glutathione levels, which are crucial for lymphocyte proliferation and activity. So a randomized, double-blind, placebo-controlled study showed that NAC supplementation reduced the frequency and the severity of influenza-like episodes in elderly subjects. It also decreased the symptom duration. Interestingly, if you go to the hospital with an overdose or liver damage or a paracetamol overdose, they actually give you IV N-acetylcysteine. That is actually the treatment protocol. So dosing-wise for NAC, the dose can be between 600 milligrams and 1200 milligrams daily, orally divided in different doses. Timing, it says daily for respiratory support and antioxidant effects or at symptom onset. Higher doses and IV forms used in clinical settings are well tolerated but should always be used and done under the supervision of a medical professional. So in summary, NAC is the precursor to glutathione, a key antioxidant that reduces oxidative stress and immune support function. NAC is the precursor to glutathione, a key antioxidant that reduces oxidative stress and supports immune function. It also thins mucus to aid respiratory clearance and modulates inflammation. Studies show that NAC can reduce the frequency, severity, and the duration of flu-like illnesses with potential benefits for COVID-19, although more research is needed. So let's now discuss glutathione. Now, many people resort to using NAC, which we just discussed, for boosting glutathione. And the reason being is glutathione is destroyed in the stomach acid, so it doesn't really have a good transporter. Now, interestingly, and there haven't been many trials, if any, on this yet, but I would be really interested to see one, is by taking glutathione liposomally, like we discussed with the vitamin C. By binding the glutathione to liposomes, it helps bypass the stomach acid and actually get into the system. I personally do take liposomal glutathione, and I have noticed a massive difference in my immunity. So let's discuss what glutathione does. So glutathione restores antioxidant defense. It combats reactive oxygen species, which are generated during viral infection. So glutathione neutralizes this. Oxidative stress can worsen inflammation and lead to tissue damage. Glutathione helps maintain the effect of mucosal surfaces in the lungs and the airways, helping to prevent viral invasion through damaged epithelial cells. It helps balance pro- and anti-inflammatory cytokines and may potentially reduce risk of cytokine storms during severe infections, especially relevant in COVID-19. Glutathione is essential for optimal function and proliferation of immune cells like T cells, which are key to clearing viral infections. It also helps boost local defense in the nasal and respiratory tract. Aerosolized or oral glutathione has been shown benefit in relieving upper respiratory symptoms. Some studies suggest that glutathione may impair viral replication by maintaining redox balance and interfering with viral protein folding processes. Case reports and small studies suggest that glutathione, oral or through IV, may relieve respiratory distress and improve oxygenation in COVID-19 induced pneumonia. So with respect to glutathione dosing, so orally between 250 and 500 milligrams liposomally. The bioavailability does vary between different supplements. You want to try and get a liposomal glutathione if possible. You can take it daily for maintenance of acute respiratory illnesses and other diseases. Remember, oral bioavailability is limited, so liposomal is favourable and preferred. IV is also used for severe cases. Once again, that is under medical supervision. In summary, glutathione is a key antioxidant that prevents against oxidative stress during viral infections. It helps to reduce inflammation and tissue damage, it supports mucosal health in the lungs, and it balances the immune responses and aids in immune cell function. Preliminary evidence suggests it may reduce viral replication and improve respiratory symptoms in infections like COVID-19. So back to a more botanical supplement. Olive leaf extract and its bioactive compounds have shown anti-inflammatory effects in human airway epithelial and vascular endothelial cells, reducing pro-inflammatory signaling in the in vitro models. There was a mini review conducted entitled Olive Leaves as a Potential Phytotherapy in the Treatment of COVID-19. The authors did note that the olive leaf has known anti-inflammatory, immunomodulatory, and antipyretic and antithrombotic effects in prior studies, which could be beneficial in viral infections such as COVID-19. So the clinical trial evidence in COVID-19, in a randomized triple-blind clinical trial of hospitalized COVID-19 patients, olive leaf extract was given between 250 milligrams or 500 milligrams every 12 hours for 5 days. This led to statistically greater improvement in clinical metrics. So these were body temperature, CRP, which stands for C-reactive protein, so this is a marker of inflammation, respiratory rate, pulse, oxygen saturation. These all had greater improvements versus placebo. So this offers some human data for its potential utility in SARS-CoV-2 infection. There is also an effect on duration of upper respiratory illnesses. So in a randomized controlled trial among high school athletes, olive leaf extract did not reduce incidences of upper respiratory illnesses, but reduced the number of sick days by 28% compared to placebo. This suggests that it may help shorten illness duration even if it doesn't prevent infection. A lab study found that olive leaf extract, which is rich in L-Linoleic acid, can block an enzyme that the flu virus uses to spread between cells, similar to how some flu medications work. In cell studies, olive leaf extract has also been shown to lower the level of key proteins that COVID-19 viruses use to get into human cells, which could help reduce infection. When it comes to dosaging of olive leaf extract, the dose can be between 250 to 500 milligrams twice daily standardized extract. You want it to be between 16 and 20% of oleuropein. The timing, it just says daily during respiratory illnesses or as a prophylactic in high-risk periods in the dosage that was recommended. Make sure you look for standardized products for consistency. So in summary, olive leaf extract contains some compounds that reduce inflammation and modulate the immune response. This shows promise in viral infections like COVID-19. Clinical trials indicate it may improve symptoms in COVID-19 patients and shorten the duration of upper respiratory illnesses. Lab studies do suggest that it can block flu virus entry and reduce COVID-19 viral entry into cells. Finally, let's discuss elderberry. So elderberry binds to viruses and blocks entry. So elderberry contains flavonoids that can attach directly to influenza virions, preventing them from entering host cells and initiating infection. It also inhibits viral replication. This is within COVID and flu. So in vitro, elderberry extract has been shown to reduce replication of SARS-CoV-2 variants in lung cell lines. It also helps modulate cytokine and immune signaling. So elderberry compounds can affect inflammatory cytokines such as interleukin number 6, interleukin number 8, and also tumor necrosis factor alpha, and shift immune response patterns in experimental models. When it comes to elderberry dosing, literature suggests that 300 to 600 milligrams standardized extract per day, or elderberry syrup, so 15 milliliters, 3 to 4 times a day. Timing wise, you should take it at the start or a first sign of illnesses and continue to 5 to 7 days. It's generally safe. You should have some caution though in autoimmune conditions due to immune stimulation that it produces. Always check with your doctor. So in summary, elderberry has been shown to block viruses from entering cells, reduce their ability to replicate, and stimulate both mucosal and systemic immunity. While more research is needed, early studies suggest it may help shorten the duration and severity of cold and flu-like symptoms, and it can support immune defenses during viral infections like COVID-19. Those were several supplemental tools that can help during cold and flu season. Everyone's getting sick right now, so I do highly recommend trying zinc, quercetin, vitamin D with K2 and magnesium, of course, also glutathione, vitamin A, and L-Glutamine. Remember, the content of this video was for educational purposes only. Please consult your healthcare professional or medical provider before making any changes to your diet or supplement routine. Supplements also need to be seen as supplements. They should not be a substitute for a high-quality, bioavailable, nutrient-dense diet, or good sleep, hydration, and exercise regimens. Thank you very much for sticking with me through that video. I hope that was useful to you. I will catch you in the next one, and that was Science Made Simple.